You're listening to Addiction Medicine Beyond the Abstract, the official podcast of the Journal of Addiction Medicine. If this is your first time listening, thanks for coming. Addiction Medicine Beyond the Abstract is produced for your enjoyment and is focused on the latest journal-published research and science in the field of addiction medicine. Remember to add us to your favorites in iTunes. You can also follow us on Twitter at ASAMorg and Facebook. Now, let's go beyond the abstract.
Welcome to Addiction Medicine Beyond the Abstract. I'm your host, Dr. Sean McNeil, Digital Content Editor for the Journal of Addiction Medicine. Today we are joined by Dr. Kelly Moore. She's a postdoctoral fellow at the Yale School of Medicine, Department of Psychiatry. Welcome to the podcast, Dr. Moore. I want to begin by asking you to introduce yourself just a bit and having you to describe your background in the field of addictions.
Yeah, so I'm happy to be here. So my background is in clinical psychology, and I got my Ph.D. at George Mason University in Virginia. And starting in my graduate training, I began working with the justice-involved population. So I worked on a larger study that was looking at an intervention for jail inmates at that point, and became really interested in, how we work with justice-involved populations and understanding how treatments kind of are implemented in those systems and whether or not they're effective in helping people adjust to the community after they're released from those systems. So I started in that work pretty early on, and after the point when I'd completed my internship, I realized I wanted more specialized training in addiction because addiction is often one of the biggest issues among people involved in the justice system. So I started my postdoctoral fellowship here at Yale to get more specialized training around addiction and to really continue researching the intersection of addiction and crime.
Okay, and that leads us to this paper that you've written. How did you get specifically involved with treating these patients in this population and measuring their outcomes?
Yeah, so I've always been personally just interested in, treatments for justice-involved populations, whether that's during incarceration or after release when people are in the community. So that's something I've always been just really interested in, and how to make those treatments effective. Because what you often find in correctional systems is that sometimes there's a lack of evidence-based treatments being available or being implemented, and it's difficult. There are a lot of logistical challenges that make treatment harder within this specific system. So I've always been interested in those issues and what, the role of clinical psychology in addressing some of that. And so with this particular study, I came onto the project when I started my postdoc, and was really excited to be involved in a project that was looking at medication-assisted treatments within correctional facilities in particular, because there's just a lack of medication-assisted treatments being used for populations of people who have opioid addiction in the criminal justice system. And it's a big problem, because what you often find is that, people with opioid addiction get incarcerated, and maybe they were, receiving a medication-assisted treatment in the community, maybe they weren't, but they often go through withdrawal upon incarceration and can't access any form of medication-assisted treatment, which then makes it less likely that they'll engage in those treatments after release, and it also increases the chances that they'll have negative outcomes like overdose and relapse when they get out. So I was thrilled to become part of this study looking at continuing the use of previously received methadone throughout the duration of people's incarceration.
And I read something interesting in the paper. You wrote about how the Department of Corrections actually became a site where these medications could be distributed. Was this one of the big hurdles in your project?
Yeah, so, Connecticut is one of the states that's really, their Department of Corrections is amazing. They're really progressive in wanting to implement evidence-based treatments for their prisoners and their jail inmates. And so the Department of Corrections was on board with, efforts to treat prisoners with opioid addiction. So they were open to allowing medication-assisted treatments to be within their facilities, and there were some, hurdles to jump over when it came to that, because methadone is regulated at different levels, and so they had to be licensed to be able to offer it in the facility and those sorts of things. But they were able, they were willing to kind of go through those steps to make sure that this treatment could be offered and to evaluate whether it was effective. And so they in partnership with the Department of Mental Health and Addiction Services in Connecticut really were excited to leap into this project and try to offer these sorts of medications to the inmate population.
Yeah, and I think that makes it a really unique study. Was there any other part of the study design that you felt was novel or that you felt like was a big challenge?
Yeah, there's been a fair amount of research, looking at implementing medication-assisted treatments in correctional systems. So that's, there's been a lot of studies looking at whether we can, induct people on these medications when they're incarcerated and see if that improves their outcomes post-release. But this study in particular was innovative in that we were continuing people on previously received methadone, which had only been done in a couple of studies. It's harder. There are just more barriers to being able to continue people's medication that they received in the community. So that was kind of the innovative piece of this study, was looking at the effectiveness of the continuation of the medication throughout incarceration. And I think also we looked at recidivism outcomes, which not every study does. Some of them do, but we looked at that in a couple of different ways to try to see, try to really get at whether this maintaining people on methadone could improve their ability to stay out of future, arrests and stay out of the justice system.
And what were some of the findings that you felt would have the broadest implications?
Yeah, so I think, we looked at behavior. We looked at the effectiveness of continuing methadone on behavior both during incarceration and post-release. And so during incarceration, we found that the inmates who were maintained on methadone had fewer disciplinary infractions. And a lot of studies actually don't measure behavior during incarceration. So that's really important, because that suggests that people, when we're able to provide them with the treatment that they were receiving in the community, they might be easier to manage, during incarceration, which has a lot of implications for, the justice system in terms of staff and resources. In addition to that, the recidivism outcomes that we looked at, it was really, I think, important that we found that people who were maintained on methadone with the same provider before, during, and after incarceration had better recidivism outcomes across the board. So that really, was the first time I think any study has shown that, and we need to look, we need to do follow-up studies and do more research on that. But it suggests that, that continuity of care in terms of the provider might be really key in helping people, helping people improve their behavior during incarceration and post-release.
Mm-hmm. What kind of impact do you expect your study to have in the justice field and the legal field?
Mm-hmm. Yeah, I think, first and foremost, with a study like this, I hope it encourages more studies to examine the continuation of medication-assisted treatments throughout incarceration. Which, it's tough because incarceration periods can range from a day or a couple weeks to years. And so it's difficult to think about maintaining people on a medication and thinking about the duration of that during incarceration. But I do hope that it encourages other studies to look at this so we can build the evidence base around it. I also hope that, the study just increases some of the acceptability of medication-assisted treatments in the justice system, which there's still a lot of stigma around using these sorts of medications for people with opioid addiction. So I hope that it tackles some of that as well and can, help people in the justice system see that, there are benefits to giving these medications during incarceration, and it can really help this population.
All right. And one final question that I had, you mentioned in your discussion that this methadone treatment may reduce the, as you put it, the aversive physiological withdrawal symptoms and then the accompanying distress that comes along with that. And that by reducing this, you might foster a more stable mental health during incarceration. Could you speak to this?
Yeah. It's interesting. The other research in this area has shown that withdrawal from methadone upon incarceration is incredibly just aversive, painful, very distressing. And so that's definitely one of the mechanisms we think could be at work here, is that people aren't undergoing all of that physical and emotional stress and illness that they would if they were withdrawing from methadone, when they get incarcerated. So I think that's probably a big factor. And we actually, as part of this study, we didn't include the qualitative results in this article, but we did ask inmates who received the methadone, what was your experience like, and how did this affect you? And a lot of them spoke to the fact that they weren't sick, and they didn't have to worry about withdrawing. They could focus on their legal issues, or they didn't. They kind of spoke to that as well. So I think that's a big part of what could influence their behavior during incarceration, for sure.
Well, I do want to thank you so much, Dr. Moore, for joining us today on the podcast and explaining your study and how the results might have an impact in the future.
Yeah, thank you.
This ends today's podcast. Thank you for listening to Addiction Medicine Beyond the Abstract. All of today's show links can be found in the show notes. Remember, you can preview additional abstracts at journalofaddictionmedicine.com. This program was produced by the American Society of Addiction Medicine.